A man in Texas has become the first person to be diagnosed with Ebola in the United States. CNN's Mary Muller has more.
The Centers for Disease Control and Prevention says the first patient to be diagnosed with Ebola in the U.S. is being treated in Dallas, Texas.
The bottom line here is that I have no doubt that we will control this importation or this case of Ebola so that it does not spread widely in this country.
The CDC says the patient flew to the U.S. from the West African nation of Liberia on September 19th and began to have symptoms 4 or 5 days later. On September 28th, he was admitted to a hospital in Texas and put into isolation. He then tested positive for Ebola.
So any contact this person had over those 4 days between when they became ill and before they were in isolation, they need to be found, they need to be put in isolation, they need to be monitored for 3 weeks.
Health officials say they are trying to track down any immediate family or people the patient had contact with. Still, they say there is a low risk of the disease spreading, and it's not contagious until someone shows symptoms. Since the patient wasn't sick on the plane to the U.S., health officials don't want people who traveled with him to panic.
We do not believe there's any risk to anyone who was on the flight at that time.
The CDC isn't sure how the patient contracted the disease. As for his condition, they will only say he is ill and under intensive care. In Atlanta, I'm Mary Muller reporting. Casey Hickox was discharged after testing negative for Ebola. She's returning to Maine to finish her 21-day quarantine in the relative comfort of her home. She was put in this isolation tent after landing in Newark, New Jersey, returning from a month of treating Ebola patients in Sierra Leone. It was done under a new policy enacted by New Jersey Governor Chris Christie and New York Governor Andrew Cuomo. Under it, all healthcare workers who've had contact with Ebola patients in West Africa must be quarantined. Hickox described what it was like.
It's just a basic tent structure. There's a hospital bed, obviously bring me food. I have kind of a porta potty type restroom, no shower facilities, and no connection with the outside world except my iPhone. This is an extreme that is really unacceptable, and I feel like my basic human rights have been violated.
Hickox said she worries her experience will discourage other aid workers from going to West Africa to help battle the Ebola outbreak. Dr. Rick Sacra, an Ebola survivor, shares those concerns.
I feel it's a disincentive for people to go. You know, if I asked you to be locked in your apartment for 3 weeks, would you say, oh, sure, with a light heart? No, you'd say, well, no, I want to find a way around this. This is not a way to facilitate our helping West Africa.
Her attorney said there is a legal basis to challenge the quarantine policies in New Jersey and New York, but the nurse isn't sure she'll pursue them. I'm Mary Muller reporting.